Jeff State EMS Program, Advanced EMT Skills, Supraglottic Airway Device. Don your appropriate body substance isolation. Manually adjust your airway using a head tilt chin lift or jaw thrust. Insert a simple airway adjunct, OPA or MPA, using a bag valve mask non-attached to oxygen, using appropriate C&E method, ventilating your patient one breath every 5 to 6 seconds with one hand on the bag. After ventilating your patient every 5 to 6 seconds, one-handed, with a bag valve mask non-attached to oxygen using room air, attach your BVM to high-flow oxygen using an appropriate oxygen cylinder. Then, begin bagging your patient with high-flow O2. Once again, every 5 to 6 seconds, one-handed. After pre-oxygenating your patient with high-flow O2, you may then pass the BVM off to your partner, having them bagging the patient while you prepare your equipment for a supraglottic airway device placement. While your partner is bagging the patient, you may begin assembling and testing your equipment. Appropriately size and test your bond insertion airway device. Attach your syringe. Inflate both bulbs. Check both bulbs for any leaks. And deflate the bulbs. You can leave your syringe attached. It'll help you later. Lube the distal tip of your King Airway device. Once you're ready, have your partner stop bagging and remove the OPA. Insert the King Airway device using a tongue jaw lift to an appropriate depth and inflate both bulbs. Once you've inflated both bulbs, use the bulb checker to make sure that both bulbs are still fully inflated in the airway. Reattach your BVM and begin oxygenating your patient. Make sure that you have no pauses longer than 30 seconds in ventilations during this skill. While bagging the patient, it is now time to assess our airway device. We can do so in many ways, but first, we need to auscultate the breath sounds to make sure that we have adequate airflow into the lungs. Using our stethoscope, we will auscultate the lung sounds in the left upper, right upper, left lower, and right lower lung fields, as well in the epigastrum, to make sure that we don't have air going into the stomach. Once completed, we will then check with waveform capnography or a colorimetric device. Shown here, we are using a colorimetric device attached to the BVM and continue bagging. Once we have verified proper tube placement, it is now time to secure the tube. We will use a commercially made tube taming device. I'll have my partner take over bagging, prepare the tube tame device. Note that some tube taming devices are a bit small for King Airways, but they do fit. One thing to be especially cautious about when placing the tube in the tube taming device is to make sure that your bulb checker is outside of the tube taming device and does not get pinched. Wrap the band around the back of the patient's neck and secure on the other side with the Velcro strap, and your tube is now secure. With the Velcro straps in place, your tube is now secure. Go back and double check your intervention. Check your bulbs, auscultate the lung fields, double check your waveform or colorimetric capnography, and double check your SpO2 readings.